The OCHIN collaborative is at the front line of treating the opioid epidemic. And as a nonprofit, our mission is to continue to support the members of the collaborative with technology, research, workflows, and advocacy, and help bend the curve on the opioid crisis in the United States.
OCHIN was developed to provide services to community health centers, federally qualified clinics, to provide them the best possible options and the most productive tools. So it's really a learning collaborative, a way that we share information.
What OCHIN does exceptionally well is drive a comprehensive medical record to enable the provider and patient to have all of their healthcare information in one place.
In the old paper records days, getting data about patients that happened outside of my clinic's walls was really difficult. Most of the time I had an incomplete record. However, nowadays I can rely on the technology that's right in front of me, supplied by OCHIN, to bring in information that I can use to drive clinical decision support so that I can provide the best care for my patients.
I think the fundamental drivers of OCHIN are innovation and collaboration. We are supporting clinics and clinicians across the country who have learned to do more with less. They're driven by innovation because they can't survive without it.
The opiate epidemic has impacted Lynn County tremendously. The difference between working the OCHIN Collaborative as opposed to a standalone clinic, it's that ability to see at a button click, did someone go to the ER and what was done and what happened and what was talked about. Having the connectivity with other providers really is huge to help identify who those patients are who may have an opiate use disorder, help prescribe more safely.
Everything that we do essentially flows through our electronic health record. When we sought to change our prescribing guidelines, we worked with OCHIN requesting that daily morphine equivalent information be available to our providers. Without the OCHIN Collaborative, there is no way that an organization like Clackamas Health Centers would be able to have a health record system as able and robust as Epic.
Tired of losing everything, to tell you the truth. I've kind of hit a bottom again. I've made some poor choices, of course, along the way to get me to where I am today. It's been a lifelong battle with addiction. No matter where I go for health care, whether it be a dental appointment, medical appointment, or inpatient, outpatient, they know who I am. All my information is there. It works well.
I think now legislature needs to step back and say, how can we promote a healthier approach to pain? We've got research, we've got data, we've got backup, but we need additional support, I think, in our whole systems.
There are three things that policymakers can do to really improve care for patients in this country. The first one is removing any artificial barriers to access to data that are protected because of substance use disorder. The second area is that we really want to promote telehealth and virtual care, because sometimes the face-to-face visits that we take for granted are not available to patients who are in more rural areas. And thirdly, we need to study what works and what doesn't. So we need to support research into the realm of healthcare and especially in substance use disorder.